Okay, I'm gonna give you two clinical scenarios. You have to identify the diagnosis before I reveal the answer, okay? A busy outpatient clinic received two patients on the same morning. A patient A is 68 years old woman and she says, Doctor, my knees hurt every time I climb the stairs or walk for a long time. The pain gets worse throughout the day, but after resting it feels better. My fingers have hard bony bumps at the tips and although my joint feels stiff, when I wake up, it lasts only 10 to 15 minutes. I also heard a grinding sound when I move my knees. And another patient B, who is 35-year-old woman, she says, every morning I wake up with the painful swollen hands and wrists. I can barely make a fist for more than an hour. Both hands are affected equally. I am tired always. My knuckles and middle finger joints are swollen, but my joint near my fingernails are normal. My feet also hurt when I get first out of the bed. After hearing these clinical features, you must have confirmed that it is the inflammation of joint, that is arthritis. But have you identified what type of arthritis is it? Well, you guessed it right. The patient A, who is 68 years old woman, have the osteoarthritis, and a patient B, who is 35 years old woman, have rheumatoid arthritis. Now, let's explore the arthritis from the basic concept, clinical features, diagnosis, and its treatment. Arthritis is a condition that causes the inflammation, pain, stiffness, and swelling in one or more joints. It can affect the people of all ages, though it is more common in older adults. It can be categorized in four main groups, that is degenerative, inflammatory, crystal induced, and septic arthritis. Crystal induced is caused by the formation of crystal. It is sudden and have the severe pain. Example is gout. And septic arthritis is due to the bacterial infection. Joint become very painful, red and swollen. The other two arthritis are degenerative and inflammatory. We will discuss them in very brief way. Degenerative arthritis. The most common example of it is osteoarthritis. Osteoarthritis is a chronic degenerative joint disease characterized by breakdown of cartilage leading to pain, stiffness, and reduced joint movement. It follows wear and tear of the joints. The causes of it includes aging, which is the most commonest, repetitive joint use, obesity, genetic factors, joint injury or trauma. The risk factor of osteoarthritis include the female gender because female contains a hormone called estrogen which promote the production of type 2 collagen and proteoglycans which keeps the cartilage strong and cushioned. But if estrogen level falls, which is generally after the menopause, then cartilage repair slow down and subchondral bone remolds abnormally, increasing the stress on the joint. The other risk factors are old age, obesity, sedentary lifestyle, and previous joint injury. Now let's dive into the pathophysiology of osteoarthritis. The various causes like aging, repetitive joint use, obesity, genetic factors causes injury at the level of articular cartilage in the joint. Then chondrocyte attempt to proliferate and repair, that is the formation of bone spur that leads to synovitis with loss of cartilage and ultimately pain and limited movement. Inflammatory arthritis. The best example is rheumatoid arthritis. It is a chronic autoimmune inflammatory disease in which the body immune system attacks the synovial joint causing pain, swelling and deformity. The causes include autoimmune reactions, genetic factors, environmental triggers, etc. Pathophysiology. Environmental factors like infection, smoking, genetic factors like HLA-DR4 and rheumatic factors causes the inflammatory synovitis which results in pannus formation which ultimately leads to deformity and ankylosis. Let's explore osteoarthritis and rheumatoid arthritis detailedly by analyzing the difference between them. Osteoarthritis follow the wear and tear of the joint, whereas rheumatoid arthritis is autoimmune disease. Osteoarthritis usually occurs above the 50 years, whereas rheumatoid arthritis occurs in between 30 to 50 years. Both arthritis is more common in women. The onset of osteoarthritis is slow and gradual, whereas often faster over week to month for the rheumatoid arthritis. The joint affected in osteoarthritis are knee, hip, spine, DIP joint, whereas MCP, PIP, wrist, feet are affected in rheumatoid arthritis. The pattern of osteoarthritis is often asymmetrical, whereas symmetrical for the rheumatoid arthritis. The morning stiffness is below 30 minutes for the osteoarthritis, whereas above the 1 hour for the rheumatoid arthritis. The pain gets worse activity for the osteoarthritis, whereas worse after the rest and improves with the movement for the rheumatoid arthritis. The swelling is mild and bony enlargement is seen in osteoarthritis, whereas soft, warm, swollen joint is present in rheumatoid arthritis. The inflammation is minimal in osteoarthritis, whereas severe inflammation is present in rheumatoid arthritis. The systemic symptoms are absent in osteoarthritis, but fatigue, fever, weight loss, malaise is seen in rheumatoid arthritis. Joint deformity developed late due to the bony changes in osteoarthritis, whereas developed from the chronic inflammation in rheumatoid arthritis. The bony nodes like Harborden and Bouchard's nodes are present in osteoarthritis, whereas rheumatoid nodules under the skin are present in rheumatoid arthritis. The bone changes into osteophyte, that is bone is for in osteoarthritis, whereas bone erosion is present in rheumatoid arthritis. The blood test is usually normal in osteoarthritis, whereas RF, anti-CCP, often positive, ESR and CRP are elevated in rheumatoid arthritis. The X-ray shows joint space narrowing, osteophyte, subchondral sclerosis in osteoarthritis, whereas joint space narrowing, erosion, osteopenia is seen in rheumatoid arthritis. The treatment is exercise, weight loss, pain relief, joint replacement if severe in osteoarthritis, whereas DMARDs, biologics, steroids, NSAIDs, physiotherapy can be treatment for the rheumatoid arthritis.